Each year, approximately 1.5 million persons are found to have pleural effusions in the United States. Over the last several years, the use of bedside ultrasound has greatly enhanced the evaluation and management of patients with pleural effusions. Pleural effusion is a common problem in the ICU setting, occurring in up to 62% of patients. The presence of a pleural effusion has both diagnostic and therapeutic implications. Large effusions can compress the underlying lung, resulting in atelectasis and impaired gas exchange. This may precipitate the need to support the patient with non-invasive or invasive ventilation, or it may delay extubation, thus potentially resulting in a prolonged ICU stay with the associated morbidity and costs. Thoracentesis and/or chest drains are used to remove fluid, air, blood, or pus from the pleural cavity. Thoracentesis will be clinically useful in up to 56% of ICU patients with a pleural effusion. Although thoracentesis is thought to be a relatively safe procedure with few complications, the incidence of pneumothorax has been reported to be as high as 20 to 39%. Tension pneumothorax is a dangerous risk of thoracentesis in patients requiring mechanical ventilation. When the needle used to drain fluid is not inserted properly, there exists a not insignificant risk of puncturing major organs such as lungs, heart, liver, and spleen. A report published by the National Patient Safety Agency, the NPSA, from the United Kingdom, has alerted all healthcare staff to the risks associated with chest drain insertion. The NPSA was made aware of the risks associated with insertion of chest drains via a number of recently reported incidents and via a systematic review of incidents resulting in death and severe harm reported to the agency's National Reporting and Learning System. The need for a rapid response to this risk was further supported by data and information supplied by the Medicine and Health Regulatory Authority and by the British Thoracic Society. The NPSA urged to take action to audit current practice and develop policies regarding chest tube insertion. Among other important recommendations, they mentioned that ultrasound guidance is strongly advised when inserting a drain for fluid. The British Thoracic Society guidelines for insertion of a chest drain make recommendations for safe practice with reference to the available research literature. Their recommendations on the insertion of chest drains specify, among other things, that imaging, including ultrasound, should be used to select the appropriate site for chest tube placement, and that ultrasound real-time scanning at the time of the procedure can help to ensure that the placement is safe despite the movement of the diaphragm during respiration.